All right, guys, you have just finished your physical therapy, either in the room or here in our therapy gym. We are going to go over some high points for you on how to make sure that you have a safe and healthy recovery when you get home. Again, my name is Stacy Brock. I am the orthopedic coordinator here at Carteret Healthcare, as well as a registered nurse.
And I'm Kaylee. I'm one of the nurses on the ortho floor.
And we're just going to go ahead and jump right in. So Kaylee's going to start talking to you about your dressing.
All right. So when you leave here, we'll make sure you have a clean dressing to go home with. These are some pictures of the dressings, just what we want you to keep an eye on. If your dressing looks like this, where it has a little bit of shadowing, we want you to just keep an eye on it, keep watching it. If it increases to this amount, it's still okay to leave on. We wouldn't want you to change it looking like this at home. If your dressing becomes fully saturated, that's when we want you to change it. So we give you an extra dressing to take home. It looks like this. It comes in a pack like this, and we give you this to clean it with. It looks like a little stick figure. So at home, only if your dressing is fully saturated and completely covered looking like this, we'd want you to change it. You pop the little arms on this. I said it looks like a little stick figure. Wipe once down the middle of the dressing and once on each side. We want you to let it air dry. Don't fan it. Don't blow it because that can introduce germs. And then replace your new dressing like this. If it continues to bleed and saturates through again, where it's completely saturated like this, we want you to call the office so the surgeon knows that it's bleeding and you don't have another dressing to change it. So you're out of options after that. When you plan to take a shower at home, we talk about the press and seal in our pre-op class. So with that, the main key is to take multiple sheets off, and we want you to kind of lay it so they overlap. We always say think of shingles on a house to keep your dressing safe while you shower. We don't want you to go completely around your knee because that could make you fall. So just remember, overlap multiple sheets like shingles on a house.
And, the next thing that we cover that's super important is really your pain management, because that's going to be the thing to make people really nervous. We are going to make sure that that is set in place for you. So we've got multiple things. Kaylee's going to start talking about some of those right now.
Okay. So you'll go home with a polar cube. Looks like this. In your room here, we've used ice and water. You can do that at home, but you'll go through a lot of ice. So what we recommend is freezing 8 water bottles. As you can see, we've got 4 in here right now. So 4 in it, and then 4 will be in the freezer, so you can swap them out. There's a top line in here, and you'll fill that with water. With that, it comes with a power cord. That'll go home with you. You just take that and either lay it up against your hip, or you can wrap it around your knee. You'll also go home with the reusable ice packs. So this is good for like when you go to physical therapy. Make sure it's frozen. Take it with you when you go to therapy. When you come out, you can put it over your leg for the ride home. It comes with 2 of the packs. It opens and you can just slide them right in. And that's good to take with you. Like if you want to go outside or in the car, make sure you have that. Also, after your procedure, the surgeons will inject a long-acting pain control. That'll be good for about 3 days. You'll have a bracelet on. It's either going to be brown or like a green aqua color. And we'll discuss that with you more at discharge, what you need to do with that. But that should help with pain control for 3 days for added pain management.
Yeah. And always remember, when you go to your physical therapy appointments, take your pain medicine about 30 minutes to an hour ahead of time. They're going to push you really hard, as you have figured out from your therapy session now. So having pain medicine on board makes a big difference. One of the other things that we've talked about with you is a muscle relaxer. If that's worked for you, make sure you're utilizing that too. And then the last thing, as long as you don't have anything implanted, so we talk about pacemaker, spinal cord stimulator. If you have those, unfortunately, you do not get this, but otherwise, everybody goes home with a TENS unit. TENS stands for transcutaneous electrical nerve stimulator. This is a fantastic method of pain control. The biggest thing is when you turn it on, you want to make sure that you turn it on slow, kind of like how you turn the volume up in a car. Okay, turn on one side, switch to the other, and turn this side on. The little lights will light up. This is preset for you. I do recommend everybody get some extra batteries. Okay. And the big thing about your TENS pads is I want you to take these off every night when you go to bed. You need to have your skin have that little bit of time to breathe. Save the plastic. And if you don't have that, then you can definitely use a piece of wax paper to put these on besides the bed. So now that we have your pain management plan in place, let's talk about preventing a blood clot. That's something that you are just more at risk for after any kind of orthopedic surgery. So for us, we do multiple methods of prevention. The first thing is you're going to go home with a blood thinner. That's either going to be aspirin, it may be Xarelto, it may be warfarin if that's something that you've been taking ahead of time. That we want to make sure you stay on, and your physician will tell you when that needs to stop. The second thing that we do is we want to make sure that you're up and walking every hour. That's important. So get up, get moving. When you sit back down, put your polar cube back on. And then the last thing that we talk about, to everybody's dismay, are these fabulous compression stockings. So if you have these on right now, which you should, you want to wear these for 20 hours a day for 6 weeks. Remember, they have to be on both of your legs. Always wear them to physical therapy because it's important to help with blood flow to the area, and it's important to have all of that compression, which helps with your body absorb all the extra fluid. Now we're going to talk about signs and symptoms of infection. This is something that me and Kaylee will go over with you multiple times. You probably heard it while you were here at some level. Things that you need to be aware of, anything that gives you pause for concern. So fever, think about any kind of drainage other than blood from your dressing, if it is hot. And when we talk about fever, that's something that's greater than 100.1 that Tylenol does not relieve. So make sure that you are taking those things seriously. Use your incentive spirometer. It's going to help open up your lungs. That helps prevent infection, which could be pneumonia. And now we're going to think about the people that you need to call. So for us, the things that you want to call your doctor for are, hey, my pain medicine isn't working, because Stacy and Kaylee cannot make that prescription for you. So call your doctor if your pain medicine isn't working. I want you to call your doctor if you all of a sudden can't stand up on your leg and you've been walking on it before. This kind of goes into DVT prevention. When we talk about a deep vein thrombosis, that's what DVT stands for. That would be your leg would be hot. It would be like a 3rd-degree sunburn hot. It's going to be swollen, much more swollen than you would normally think. And it's going to be super painful to the touch, especially back around the calf area. Those are things you need to call your doctor about. If you notice that you are having shortness of breath, difficulty breathing, chest pain, do not call us. Do not call your doctor. Call the rescue squad, because you have bought yourself another visit to Carteret Healthcare. Okay? Things that you can call me for: you need another pair of compression stockings, you've had a problem with your polar cube, maybe something with your TENS unit. So we are not going to be the middleman for the office. We're going to try to tackle things from there. Haley?
The last thing we want to talk to you about is, if you have had a hip replacement, we want you to follow your hip precautions. We give you a little folder that has all the information about that, about the precautions. We've discussed them with you every time you're getting up. Also, here we have your hip kit. We talk about this in the pre-op class. Also,
Yes.
The therapist will come in and review that with you. So we want to make sure that you have this before you leave and that you're comfortable with all the items in that.
So thank you guys so much. We truly have really loved taking care of you, and we hope that you have a wonderful rest of your day and healthy recovery. Take care.
Bye.